It feels like just yesterday we were 20, maybe 30, and our bodies felt invincible, didn't they? We bounced back faster, slept deeper, and didn't give things like energy levels or aches and pains a second thought. But time has a way of reminding us that things change, and that's okay. What's important is understanding those changes and how they affect every part of our lives, even the parts we might not talk about much. There are aspects of our health and well-being as older men that are often kept quiet. Things we might not even think to ask our doctor about. And sometimes, in that quiet space, we can unknowingly fall into habits that aren't serving us as well as they could, or might even be causing subtle harm over time. It's not about judgment, it's about awareness and taking care of ourselves. There's a quiet reality that certain activities that felt effortless and purely pleasurable in our younger years might require a bit more thought and understanding now that we're over 60. It's a part of aging that nobody really spells out, and because of that, some simple, understandable mistakes can happen, silently impacting our health or missing opportunities to actually improve it. We're going to gently explore some of these often overlooked points that a doctor might bring up if you felt comfortable asking, focusing on common masturbation mistakes older men can make after 60, and how addressing them can actually lead to better physical and psychological health. This isn't about stopping or changing something natural. It's about doing it in a way that supports your body and mind as they are now. We'll look at why understanding these points is crucial for maintaining vitality and avoiding potential pitfalls. Stick around, because watching to the end will reveal something that might truly surprise you about how simple awareness can make a world of difference. Let's start with one of the first things that often comes up, even if indirectly, when talking about physical activity and the aging body: frequency and intensity. Now, it might sound a bit strange to link masturbation frequency to other physical activities, but in terms of how the body responds, recovers, and handles physical exertion, there are parallels. When we were younger, our bodies were incredibly resilient. We could push harder, recover faster, and the physical toll of activities, even solitary ones, seemed minimal. But as we age, recovery time lengthens, tissues aren't as elastic, and joints or muscles that might have pre-existing wear and tear become more noticeable. A common mistake isn't necessarily doing it at all, but perhaps maintaining a frequency or intensity that the current body isn't equipped for without potential strain. Think about it like running. You might have been able to run a marathon in your 30s, but doing that same marathon every day in your 60s is likely going to lead to injury or burnout. The same principle applies here, albeit on a different scale and in a different context. Excessive frequency, especially if done vigorously, can put repetitive strain on the pelvic floor muscles, the perineum, and even affect the lower back or wrists. It's not usually a sudden dramatic injury, but rather a cumulative effect. You might notice persistent minor aches or a feeling of fatigue that doesn't seem linked to anything else. This silent strain can, over time, potentially contribute to issues like pelvic floor dysfunction, which can manifest in problems with urination, bowel movements, or even discomfort during other physical activities. The body sends signals, often subtle ones like a twinge, a lingering ache, or just feeling unusually drained afterward. Ignoring these signals and pushing through with the same frequency or intensity as decades ago is one mistake. The body is telling you it needs more time to recover or a gentler approach. What does this mean in practical terms? It means listening to your body is paramount. If you feel discomfort during or after, if you feel unusually tired the next day, or if there are any persistent aches, those are signs to perhaps reduce the frequency or modify the technique. It's about finding a rhythm that feels comfortable and energizing, not draining or painful. It's not about setting a strict limit that applies to everyone, but about personal awareness. Maybe instead of daily, every other day feels better. Maybe slowing down or changing positions makes a difference. The key is responsiveness to your body's current state. This isn't about limitation. It's about optimization for health and comfort. By acknowledging that recovery takes longer and tissues are different, you avoid putting unnecessary repetitive stress on areas that are already undergoing natural changes with age. It's a shift from a mindset of youthful resilience to one of mature self-care. Avoiding this silent strain is the first step in ensuring that this natural activity remains a source of comfort and release rather than a hidden source of physical wear and tear. It's like knowing when to rest your knees after a long walk. It prevents bigger problems down the line. This careful consideration of frequency and intensity, tailored to your individual physical state right now, is vital for long-term comfort and avoiding unnecessary physical complaints. It's a simple adjustment, really, but one that makes a significant difference in how your body feels day to day. Now that we've discussed listening to your body regarding frequency and intensity, let's move on to another related point, often overlooked, which is the specific technique used. Continuing our conversation about ensuring comfort and avoiding strain, let's talk about technique. Just as the frequency or intensity might need adjustment, the specific way you engage in masturbation can also impact your physical well-being as you age. Younger bodies are often more forgiving of repetitive motions, friction, or awkward positions. However, with age, skin becomes more delicate, connective tissues change, and things like joint flexibility might decrease. Relying on the exact same techniques used for decades without considering these physical changes can lead to irritation, chafing, or even minor injuries over time. For instance, using excessive friction or a dry technique can cause skin irritation, which not only is uncomfortable, but can also increase the risk of minor abrasions or infections, especially in an area that needs good hygiene. As skin loses some of its natural elasticity and moisture, it becomes more susceptible to damage. Similarly, certain grips or pressures that felt fine years ago might now put undue strain on wrists, fingers, or even lead to discomfort in the penis itself if done aggressively or repetitively in a specific way. Awkward positions maintained for extended periods can strain the back, neck, or hips, areas that might already have age-related stiffness or discomfort. The mistake here isn't in having a preferred technique, but in failing to adapt it as your body evolves. Think of it like gardening. You might need different tools or a different posture to comfortably tend to your plants now compared to 20 years ago. For this, incorporating lubrication is a simple yet effective solution. Using a good quality lubricant can significantly reduce friction, making the experience more comfortable and preventing skin irritation. There are many types available. Water-based, silicone-based, finding one that works for you makes a real difference. Experimenting with different techniques, perhaps using more of the hand or varying the pressure and rhythm, can also distribute the physical effort and reduce strain on one specific area. Pay attention to your body during the act. If you feel any discomfort, tingling, or numbness, it's a sign that the technique or position might need adjustment. It's about being mindful and willing to adapt. This isn't about making it complicated. It's about making it comfortable and sustainable. Gentle exploration of what feels good and comfortable now is key. This leads us to another important area, the psychological aspect and how masturbation fits into our overall emotional landscape as we age. While it's a natural and healthy part of human sexuality at any age, for some older men, it can inadvertently become a primary or sole outlet for intimacy or stress relief, sometimes masking deeper feelings of loneliness or a lack of connection. Using masturbation as a way to cope with these feelings without addressing the underlying issues isn't inherently harmful physically, but it can silently impact emotional well-being. It can become a substitute for seeking meaningful social interaction, maintaining friendships, or even pursuing new relationships or hobbies that provide connection and purpose. The mistake here isn't the act itself, but if it becomes the only coping mechanism or a way to avoid confronting feelings of isolation. Loneliness is a significant health risk factor for older adults, impacting both mental and physical health. If masturbation is the only thing you look forward to, or the only way you feel a sense of release or comfort, it might be a signal that other areas of your life related to social connection and emotional support need attention. It's about balance. It's healthy to have this as a personal outlet, but it shouldn't be the only outlet for feeling good or connected. This doesn't mean you need to go out and become a social butterfly overnight, but it might mean exploring opportunities for connection, whether through joining clubs, volunteering, reaching out to family and friends, or finding online communities that share your interests. Addressing feelings of loneliness or lack of connection directly, perhaps even talking to a therapist or counselor, can significantly improve overall quality of life and prevent masturbation from becoming an unintended substitute for broader emotional needs. It's about enriching your life in multiple ways, ensuring that physical pleasure is a part of a fulfilling life, not the sole source of comfort in the face of isolation. This brings us to another crucial point related to physical health: ignoring potential pain or discomfort. As we age, It's easy to dismiss minor aches or changes as just part of getting older. While some changes are normal, persistent pain or discomfort during or after masturbation is a signal that shouldn't be ignored. It could be related to the technique or frequency as we discussed, but it could also be a sign of something else that needs medical attention. Conditions like prostatitis, inflammation of the prostate, benign prostatic hyperplasia, BPH, prostate enlargement, or other urological issues are more common in older men and can cause discomfort in the pelvic area. Ignoring pain during sexual activity, including masturbation, is a mistake because it could be an early warning sign of one of these conditions or something else entirely. It's not about panicking, but about prudent self-care. If you experience persistent pain, burning, or unusual sensations, bringing it up with your doctor is important. It might feel awkward to discuss, but doctors are used to talking about all aspects of health, and these symptoms could be indicative of something treatable. Early detection of conditions like BPH or prostatitis can lead to effective management and prevent complications down the road. Similarly, changes in erectile function or ejaculation patterns during masturbation, while sometimes age-related, can also be indicators of underlying health issues like cardiovascular disease, diabetes, or hormonal imbalances. These are not necessarily masturbation mistakes in terms of technique, but ignoring these changes. While masturbating is a mistake from a health perspective, it's about using this private activity as an opportunity for self-awareness regarding your overall health. If you notice significant changes that are persistent, mentioning them to your doctor is crucial. They can help determine if it's a normal age-related variation or if it warrants further investigation for potential health conditions. This links back to the idea that our sexual health is intertwined with our general health, and paying attention to signals during moments of intimacy can provide valuable insights into what's happening elsewhere in the body. So, ignoring persistent discomfort or changes you notice during masturbation is definitely a mistake to avoid. Next, let's consider something often overlooked but vitally important for hygiene and preventing issues. Building on the theme of physical comfort and health, let's address hygiene. A seemingly simple point, but one that becomes increasingly important as we age. Our body's immune responses can shift, and maintaining good hygiene in all areas, including during and after masturbation, is crucial for preventing infections or irritation. A common mistake isn't necessarily poor hygiene, but perhaps not being as diligent as is needed in later years. This could involve not cleaning the hands thoroughly beforehand, especially if they've been handling other things, or not cleaning the genital area adequately afterward. Sweat, natural bodily fluids, and friction can create an environment where bacteria can thrive. For older men, conditions like balanitis, inflammation of the head of the penis, can be more likely, and poor hygiene is a significant risk factor. This isn't about being obsessive, but about mindful cleanliness. Simply washing your hands thoroughly with soap and water before and after, and gently cleaning the genital area with mild soap and water afterward makes a big difference. If using any devices or toys, ensuring they are kept clean according to the manufacturer's instructions is also vital. For uncircumcised men, gently pulling back the foreskin and cleaning underneath it is particularly important to prevent the buildup of smegma, which can lead to irritation and infection. It's a basic step, but easily overlooked if it's not a conscious habit. Maintaining good hygiene in this area contributes not only to comfort and prevents localized issues, but also supports overall health by reducing the risk of infections that could potentially cause more widespread problems or require medical intervention. It's a simple habit, but a cornerstone of self-care that becomes even more significant as we get older. Another aspect that ties into both physical and mental well-being is the environment and mindset surrounding the activity. While the act itself is private, the context can matter. If masturbation is consistently being done in secret, with feelings of shame or guilt, or in an environment that feels rushed or stressful, these negative emotions can become associated with the act itself, diminishing its potential as a positive outlet for release and comfort. While society has become more open about sexuality, older generations might still carry ingrained beliefs or taboos that create internal conflict. Engaging in the activity while wrestling with these negative feelings isn't physically harmful in a direct way, but it's a missed opportunity for positive emotional and psychological well-being. The mistake here is allowing outdated beliefs or self-judgment to tarnish a natural human function. It's about acknowledging that sexual feelings and needs are normal at any age, including after 60. If you find yourself feeling guilty, ashamed, or stressed about it, addressing these feelings is important. This might involve challenging old beliefs, talking to a trusted friend or partner if you have one, or even speaking with a therapist who understands sexual health and aging. Approaching masturbation with a sense of self-acceptance and doing it in a comfortable, relaxed environment can transform it from something potentially associated with negativity into a truly positive experience that contributes to stress reduction and a sense of well-being. It's about giving yourself permission to experience pleasure without judgment. Furthermore, let's consider the potential interaction with existing health conditions or medications. As older men often manage various health conditions like heart disease, diabetes, or prostate issues, and take multiple medications, it's important to be aware of how these factors might intersect with sexual activity, including masturbation. While generally safe, certain medical conditions or medications can impact sexual function, sensation, or even recovery time. Ignoring these potential interactions is a mistake because it means you might not be prepared for or understand changes that occur, or you might inadvertently put extra strain on your system depending on your specific health profile. For example, men with severe heart conditions might be advised by their doctor to avoid strenuous physical activity. And while masturbation is generally not considered high intensity, understanding your personal risk level based on your doctor's assessment is wise. Similarly, some medications can affect blood pressure, heart rate, or even cause changes in sensitivity or ability to achieve orgasm. Experiencing these changes without understanding the potential link to your health condition or medication can cause unnecessary worry or confusion. This isn't about seeking specific medical advice here, but highlighting the importance of open communication with your doctor about your sexual health as part of your overall health management. Mentioning any changes you notice or discussing concerns about sexual activity in the context of your health conditions and medications is crucial. A doctor can provide personalized advice based on your medical history, helping you understand what's normal for you given your health status and treatments, and advising if any adjustments are needed in your approach to sexual activity, including masturbation. The mistake is assuming that sexual health is separate from the rest of your health and not discussing it with your healthcare provider, especially when managing chronic conditions. It's about integrating sexual well-being into your overall health picture and seeking professional guidance when needed. Lastly, let's touch upon the missed opportunity to use this activity for self-exploration and understanding. While it can be a purely physical release, masturbation can also be a valuable tool for understanding your body, what feels good, and how your sexual responses are changing with age. Focusing solely on achieving orgasm quickly, perhaps as you did in younger years, without taking the time to explore other sensations or slower rhythms, can be a missed opportunity for deeper self-awareness and pleasure. As the body changes, the types of touch, pressure, and stimulation that feel most pleasurable might also change. Taking time during masturbation to explore different areas, pressures, and speeds can lead to discovering new sources of pleasure and a more nuanced understanding of your body's current responses. It's about shifting the focus from just the end goal to the entire process. This mindful exploration can enhance the experience and keep it fulfilling as you age. The mistake is sticking rigidly to old habits without curiosity or willingness to discover what feels best now. This self-awareness gained during private moments can also positively impact partnered intimacy if that is part of your life. So, we've talked about listening to your body regarding frequency and intensity, adapting your technique for comfort and preventing irritation, addressing potential feelings of loneliness or isolation rather than using masturbation as the sole coping mechanism, paying attention to pain or changes as potential health signals that require medical attention, maintaining good hygiene to prevent infections, approaching the activity with self-acceptance rather than shame, discussing sexual health in the context of your overall medical conditions and medications with your doctor, and using it as an opportunity for self-exploration and understanding your changing body. It might seem like a lot to consider, but really, it boils down to a few key things: self-awareness, gentle self-care, adaptation, and open communication with your healthcare provider when needed. Remember, experiencing sexual needs and desires at any age, including after 60, is perfectly normal and healthy. This conversation isn't about telling anyone to stop or feel bad about a natural activity. It's about empowering you with information to ensure that this part of your life remains a source of comfort, pleasure, and contributes positively to your overall health and well-being as you navigate the aging process. Small changes like being more mindful of technique or listening to your body's signals can make a big difference in preventing discomfort or issues down the line. And opening up, whether to yourself about your feelings or to your doctor about physical changes, is a sign of strength and self-respect. Don't underestimate the power of acknowledging these quiet aspects of health. Taking proactive steps now can help you avoid potential problems and continue to live a full and satisfying life in every way. Your health and happiness are paramount. We'd love to hear your thoughts or experiences in the comments below. It's a sensitive topic, but sharing can help others feel less alone and more informed. If you found this video helpful, please give it a thumbs up. It helps us know we're creating content that matters to you. And don't forget to subscribe to the channel for more videos aimed at helping you live your best life at every age. We're here to explore all aspects of health and well-being for older adults, the ones often overlooked, to help you thrive. Live your best life at every age.